This vaccine is used to help prevent certain serious, sometimes fatal, bacterial infections such as meningitis and meningococcemia. These infections can cause severe problems such as hearing loss, brain/nerve problems, paralysis, blindness, seizures, and loss of limbs, even with antibiotic treatment. The vaccine works by increasing the body's natural defense, immunity, against the bacteria that cause meningococcal disease. Vaccination is the best way to prevent infection, but it may not fully protect everyone who receives it. The brand and dose of vaccine you receive depend on your age, and other vaccines may also be given at the same time, usually in a different site on the body. It is important to consult with your healthcare provider for the best time to take this vaccine and the recommended daily dosage. Before receiving the vaccine, it's important to read all the information available from your healthcare professional. If you have any questions, don't hesitate to ask them. This vaccine is administered by injection into a muscle by a healthcare professional. For adults and children, the injection is usually given in the upper arm, while infants receive it in the upper thigh. The number of times the vaccine is given depends on your age, so make sure to ask your healthcare professional for your recommended vaccine schedule. After receiving the vaccine, fever may commonly occur, especially in infants and children. In this case, your healthcare professional may recommend a fever/pain relief medication, such as acetaminophen, for use if needed. Details about this can be discussed with your healthcare professional. Some common side effects of Penbraya, PF, 5 Mcg-120 Mcg/0.5 ml intramuscular kit meningococcal vaccines, Serogroups A, C, YW135 may include pain, redness, or swelling at the injection site, headache, fever, chills, drowsiness, tiredness, joint or muscle pain, nausea, loss of appetite, or diarrhea. If any of these effects persist or worsen, it's important to notify your healthcare professional promptly. Rarely, some people may experience symptoms such as fainting, dizziness, vision changes, or ringing in the ears immediately after receiving the vaccine. If you experience any of these symptoms, it's important to inform your healthcare professional right away. Sitting or lying down may help, as these symptoms typically do not last long. It's important to remember that this medication has been prescribed to you because your healthcare professional has determined that the benefits outweigh the potential risks of side effects. Many people who use this medication do not experience serious side effects. You should contact your healthcare professional immediately if you experience any serious side effects, including numbness or tingling, or muscle weakness. Although very rare, a serious allergic reaction to this drug may occur. Seek medical assistance immediately if you notice any symptoms of a serious allergic reaction, such as rash, itching or swelling, especially of the face, tongue, or throat, severe dizziness, or trouble breathing. This is not a complete list of possible side effects. If you notice any other effects not listed here, it's important to contact your healthcare professional. Please consult your healthcare professional for medical advice about side effects. Before receiving the Penbraya vaccine, make sure to inform your healthcare professional about any allergies you may have. This vaccine may contain inactive ingredients that can cause allergic reactions. It's important to discuss your medical history, especially if you have a current fever or illness, Guillain-Barré syndrome, or immune system disorders. After receiving the vaccine, be cautious as it may cause drowsiness. Avoid alcohol or marijuana as they can make you even more drowsy. It's best to avoid driving or using machinery until you can do so safely. Limit your alcoholic beverages and speak to your doctor if you are using marijuana. If you are pregnant, Penbraya should only be used if clearly needed. Make sure to discuss the risks and benefits with your healthcare professional. It is not known if this vaccine passes into breast milk, so consult your healthcare professional before breastfeeding. It's important to be aware of potential drug interactions that could impact how this vaccine works or increase your risk for serious side effects. Make sure to keep a list of all the products you use and share it with your healthcare professional. This includes prescription and non-prescription drugs, as well as herbal products. Do not start, stop, or change the dosage of any medicines without your doctor's approval. Some products that may interact with this vaccine include drugs that weaken the immune system, such as cyclosporin, tacrolimus, cancer chemotherapy, and corticosteroids like prednisone. Penbraya, PF, 5 Mcg-120 Mcg/0.5 ml intramuscular kit meningococcal vaccines, Serogroups A, C, Y, W135, is a vaccine used to protect against meningococcal disease caused by serogroups A, C, Y, and W135. It is recommended for individuals aged 2 months and older, including those at increased risk for meningococcal disease. The vaccine is administered as a 0.5 ml injection into the muscle. It is important to follow the recommended dosing schedule and consult with a healthcare professional for the optimal timing of the vaccine. Taking this vaccine can help prevent serious and potentially life-threatening infections caused by meningococcal bacteria. Make sure to keep a record of the vaccines you and your children receive. This will help you and your children's healthcare providers keep track of which vaccines have been given and when, which can prevent unnecessary revaccinations in the future. It's also important to share this record with your children once they are grown, so they can provide it to their own healthcare professionals. This can help ensure they receive the appropriate vaccinations as adults. It's crucial to make sure you or your child gets each dose of the Penbraya vaccine on time. Ask your healthcare provider about the schedule for each dose and mark it on your calendar to keep track. This will help ensure that you receive the full benefits of the vaccine. Remember to store the Penbraya, PF, 5 Mcg-120 Mcg/0.5 ml intramuscular kit meningococcal vaccines, Serogroups A, C, Y, W135 in the refrigerator, but don't freeze it. Different brands of this medication may have different storage needs, so always check the product package for specific instructions or ask your pharmacist. And remember to keep all medications away from children and pets. When it comes to discarding this product, do not flush it down the toilet or pour it into a drain unless instructed to do so. Instead, properly discard it when it is expired or no longer needed. You can consult your pharmacist or local waste disposal company for the best way to do this. If you need more help, call your doctor for medical advice. In the US, you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.